Hello and welcome. Some quick data first on COVID-19. In India, at this point, roughly 202 million vaccine shots have been given. About 159 million shots are for the first dose, and about 43 million people for two doses, which means they've been fully vaccinated at this point. The number of tests are 2.1 million for all of India. Remember, this is a billion plus population. And there are about 315,000 deaths at this point of time. And we do know, of course, that the number of deaths that are officially reported are quite different from the number of deaths actually seen. So this is broadly where we stand as a country at this point of time. We are also experiencing epidemics within the pandemic. The epidemic is of black fungus or mucormycosis. In some states in India, it is particularly bad and also reflects, amongst others, the problem of perhaps over-medication and the over-administration of steroids to patients who were being treated for COVID-19. So this is where we are. The questions are here as follows. One is, what is it that we can learn from the last 1 year, which is the first wave and the second wave, which is, of course, in India, at least in some metros and many cities, easing off at this point of time, and that we can take forward to what is likely to be now a third wave. Second is, what is it that we can do, keeping in context the Indian environment, where maybe doctors are pressurized to over-medicate because they don't want patients, or patients don't want to go to hospitals, or they fear the public health system. So how is it that we can approach that better if we were to be faced with a similar or a dreaded public health emergency going forward? So these are some of the questions, and I'm putting them to Dr. S Vincent Rajkumar, an oncologist at the Mayo Clinic in the United States. He is also the editor-in-chief of the Blood Cancer Journal, and an Edward W. and Betty Knight Scripps Professor of Medicine at the Mayo Clinic. Dr. Rajkumar originally did his MBBS at the Christian Medical College in Venlore and at the Madras University. Dr. Rajkumar, thank you very much for joining me today. So first question, before I get down to the diagnosis or the prescription, how is it, or why is it that you're following the India situation so closely?
Well, I was born and brought up in India. I did my medical school there, as you mentioned. And all my family lives in India. I mean, my parents live there, my brothers, my sister. So, and I have a huge number of friends and relatives. So naturally, we are following the situation very closely. And a lot of people have reached out to both myself and my wife, who's also a physician, in terms of just advice and actual patient care, to counseling for physicians on strategies.
Right. So let's look at what's been happening in the last 1 year. Now, in the United States has also seen a huge spike in cases, a huge number of deaths. And of course, now it's easing off, very likely due to vaccination, which obviously has acquired a much greater pace than many other countries. In India, we are also easing off on the second wave now, but not necessarily because of vaccination, except possibly in one or two places. So how do you look at these two situations at this point?
So in the US, we got hit with at least 3 waves in the last year, in 2020. And each time the wave was suppressed with a lockdown or a social distancing containment measure. The most recent one, I think, is very much the effect of vaccines, which started in early December. And by now, half the adults in the US have had at least 1 dose. And a majority of patients who are 65 and older have been vaccinated. So this time, we are seeing the lowest number of cases in almost a year. Deaths are coming down and things seem to be under control. There is some hope now that this time, as we relax restrictions, that the 4th wave or something like this won't happen again, because most of the population would be vaccinated. In India, you had a really significant wave last year. And somehow, as social restrictions were lifted towards July onwards, the cases continue to drop quite a bit till probably September. But progressively, people got more and more confident that that the pandemic is over. This time the cases are very high and it's coming down, but you have 90% of the population still not vaccinated. So the difference is that if you relax, things will come right back because the population is still susceptible.
Right. So, and you say that because you feel the virus is fundamentally alive and kicking everywhere.
Yes. Yes. The virus is a new virus. Most of us are not susceptible to it. Even if half the country in India has had COVID already, that still leaves another 700 million people susceptible. And that would be a huge number of deaths. And so we have to assume that either we have had COVID or have COVID, or we are going to get COVID. And that's the only way to protect ourselves. And the only way out is through vaccination of at least 70-80% of the country.
Right. Now, I'm going to come to the third wave questions in a bit. Now, you've been actively almost campaigning about the nature of administration of medicines and prescriptions in India, and specifically the use of steroids. Now, I'm sure you understand the Indian context and why doctors do it, and maybe the socio-medical system, if that were to be the case. How do you see us coming out of that, and what could be solutions?
So, again, you have to step back and see why this enormous second wave, almost like a spike, happened. As I mentioned, it happened because, one, there was relaxation of social distancing, crowding, and that was a key problem. And number two, mask compliance became very, very low. That allowed the virus to transmit very easily among people, and also at a higher viral dose, because you're not wearing masks, so when you do get exposed, it's a higher viral dose. But the third factor is that the virus itself became more transmissible, potentially more virulent. And so you're faced with a triple threat here. That alone is going to cause a huge number of deaths. But when it all happens at the same time, you have a really crushing blow to the healthcare system, which is now facing an onslaught of cases. And so the deaths from COVID are amplified by any mistakes we make or any shortages of healthcare resources. So what would have been a 2% mortality is now a 20% mortality. And that's the same thing that happened early on in Lombardy and in New York, when the cases came very fast and all at the same time. So what's happening now is that, one is that you have shortages of beds, shortages of medications, oxygen. But then we also want to do something, and that has led to the overuse of steroids and antibiotics when they are completely not necessary. And what happens then is that you get complications of these, which could be deadly serious and cause more problems, everything from secondary infections with bacteria to black fungus infection and other problems. So I think you compound what was already a bad situation with a more transmissible virus with all these other things that happen to the healthcare system.
Right. So if you were to, look at the way, let's say, people consume medicine in India, and this is a lifelong problem, right? For many of us, over the years, we've been maybe overprescribed antibiotics, and we've taken them for cases maybe we shouldn't have. Now, when faced with a situation like COVID-19, with all the other threats of it becoming fatal and so on, will then changing that strategy help? And will, let's say, for instance, suppose the doctor says that no, do not take any antibiotics, do not touch steroids at this point, at least for the first 8 days, and stay put. But the patient says, I've always taken antibiotics in my life, and and maybe it's worked. So what do you do?
Well, here's the thing. We have to make sure that physicians are totally clear on what steroids can and cannot do. Steroids are not antivirals. They actually promote viral growth because they suppress the immune system. They kill the plasma cells that help you fight infection. So by giving it early, Yes, the fever will go away. The patient might feel better. But behind the scenes, the steroids are actively encouraging the virus to replicate and cause problems. And you will end up with worse outcomes. Number one. Number two is there is a right dose. Too high a dose and it becomes toxic. And I've seen steroids prescribed at very high doses, much, much more than what the recovery trial shows, sometimes 5 times more. And thirdly, given for a very long duration. Unless somebody is on steroids for 2 months or something, you don't need to taper the steroids. It's 5 to 10 days and stop. But people are giving steroids for 5 to 10 days at high doses and then continuing them week after week after week. That will suppress the immune system. And initially, it will promote COVID to grow. And later on, it will promote black fungus and bacteria to grow. And so people have to be very clear that, number one, this is not an antiviral treatment. It is used to suppress a very active immune system that is causing lung damage. And you need to do that only if the oxygen level is less than 92%. And then only at an equivalent of 6 milligrams of dexamethasone for 5 to 10 days and stop. Because beyond that, if you have a problem, it's not due to COVID or COVID inflammation. It's something else. And so steroids won't fix that.
Right, and you've I'll come to the dexamethasone in a moment. So you're saying that even if a patient is in some ways used to taking an antibiotic at the first sign of trouble, he or she should be counseled not to take it, because I mean I'm just wondering how could one
Yes.
I mean how can doctors do that better, rather than
Yes.
trying to fight the other battle? Yeah.
So, again, I did practice medicine in India before I moved to the US. So I know how the patients are and how things are. Part of the problem, I don't want to blame the patients here because the patients are not aware of the pros and cons of antibiotics or steroids. We are. And I've seen prescriptions which routinely include antibiotics, azithromycin or doxycycline, including in guidelines. And that is completely unnecessary, and it will promote bacterial resistance, and it will promote infection with drug-resistant bacteria. So all we need to do is counsel the patients from the beginning that this is a viral infection. Steroids are going to make it worse. This is a viral infection, and antibiotics are not going to have any effect on it. Very few patients with COVID in the first week or so get a secondary bacterial infection. So we don't need to give it. Just give the prescription for what works. That will be paracetamol for fever. And just tell them to watch their oxygen concentration with a pulse oximeter. And if they feel short of breath, very short of breath, particularly walking, and or at rest, and then with the pulse oximeter showing a lower oxygen concentration, that's when they seek medical help. That's when steroids might help. Antibiotics are used only if there is a real indication of a secondary bacterial infection.
Right, and the point is that even in normal times, you should not be over-medicating yourself.
Yes,
it's not
absolutely.
just about COVID.
Absolutely.
Right.
Because we do see a problem, forget COVID. We all are aware of drug-resistant bacteria as being a big problem in India. And that is clearly related to widespread use of antibiotics that are very broad spectrum. You wipe out all of the susceptible bacteria and then you allow all the resistant ones to grow. That's why you have in hospitals in India drug-resistant bacteria that are resistant to all the antibiotics that we have. Same thing with fungi. You have Candida that's resistant to all the antifungals. So you want to be really judicious in the use of antibiotics, antifungal agents, so that when you need them, they are there for you.
Right. So, and dexamethasone is something that you've talked about and how to administer it and your own lessons from it. Walk us through that.
Well, dexamethasone is a drug that I have studied for more than 20 years because we use it as a treatment for multiple myeloma, cancer of the plasma cells. Now, plasma cells are the cells that make antibodies. So when you get a vaccine, plasma cells make antibodies, and that's how you get protection from COVID. When you get COVID, plasma cells make antibodies and try to help you fight COVID infection. We use steroids in the oncology field to kill these plasma cells. So they're very powerful weapons to suppress the immune system. And early on, when I started my career, the amount of steroids we used, even for a cancer like multiple myeloma, was too high. And we did a study where we compared high dose versus low dose, only to see if the low dose gave the same benefit with less side effects. But what we found was beyond our imagination that the low dose actually saved lives. We had 10% people die in the first year just from the high dose of steroids. So we've been using lower dose of steroids for all these years, like 15 years plus in myeloma, as a result of that trial. I know how bad these drugs can be. When used appropriately, 5 to 10 days, 6 milligrams, it works really well. And that too only when the patients are hypoxic. You use it at a higher dose, you use it for a longer period of time, it will cause everything from higher risk of blood clots to higher risk of secondary infections to black fungus. So just keep that lesson in mind. And the second point I would make is the big mistake that I see happen over and over again is not getting the equivalent dose of dexamethasone correct. If there is a shortage of dexamethasone, people are using solumedrol, methylprednisolone, or prednisolone, and the equivalent dose is 32 milligrams of solumedrol or methylprednisolone once a day. But routinely, I see twice a day or even 200 milligrams or 500 milligrams of methylprednisolone. That will really suppress the immune system more than you need it to.
Right, and I know you've given us some very specific medical let's say or medicine prescriptions. Now each patient is different, and therefore a physician should also be adjusting to that patient's physiology or physiognomy and so on.
Yes, and that's where you need to know how powerful these medicines are. 6 milligrams of dexamethasone is a big dose. You don't gain anything more by giving twice that amount or thrice that amount to anyone unless they have cancer of some kind that you're trying to deal with. So just to recognize that for most patients in India, I think even 6 milligrams may be too much, because that was based on body weights that are seen in the West. And I have, even for the diseases that I deal with, we've generally used lower dose of steroids. We use 40 milligrams in the US for myeloma treatment. We recommend sometimes for Indian patients only 20 milligrams. So for the body weight and body surface area of Indian patients, for most of them, even 6 might be too high. What it also does, I think this is important, is that it will universally increase the blood sugars. And there's a lot of diabetes, lot of unrecognized diabetes in India. And in a crunch where everybody's fighting for oxygen, the last thing people check is the blood sugars carefully. And when you're putting patients on steroids, and particularly higher doses, that's going to go up as well. And that's like number one reason for Mucor.
Right. Right. So let me come back to the question on the third wave. Now, given again your understanding of how this disease has progressed, the treatments that the medical fraternity has performed. Now, what's your sense? What could a third wave potentially have that's different? For instance, the second wave clearly in India has afflicted more younger people. It clearly showed up the fact that we were overdosing when it came to steroids and are facing the consequences thereof. And of course, the behavior of the virus itself and its transmissibility and its infectiousness. How do we, if we were to sort of blue sky gaze and say what could happen in the third wave, what would it be from your understanding and experience?
I think the fundamental lesson I learned last year, because we all made mistakes, including me, on what was going on in India, was that somehow Indians are protected from the virus due to pre-existing COVID immunity of some kind. But really, the reason the numbers came down in India with the first wave was because people were scared of the virus. They did take precautions, they did wear masks, and there were lockdowns. And so that really got the wave into control. This time, the wave was much worse, and I have no idea how many people were affected in each day, because the counts are hard to come by. And again, every state is in lockdown. And so the cases are naturally coming down, particularly in the urban areas and the cities. Again, we don't have insight from the rural areas. But keep in mind that this is coming down because of social restrictions, because people are not coming in contact with other people, and because people are wearing masks. At this point, a third wave is fully in our control. It will happen only if people relax too early. It can be avoided or it can be minimized if people understand that they are still susceptible until they are vaccinated. And so the real key is eventually when the test positivity goes to 5% or lower, as restrictions are relaxed, people still need to be educated that you are susceptible, you will get COVID, there will be a third wave, unless you wear masks and you avoid crowds and don't invite people into the house that you don't need to see, and just keep your distance till you get your vaccine dose. And this time, at least, there is a way out of this, which is vaccinations. And as vaccination rates go up, then you feel more and more free. The third wave could be as bad as the second wave and affect younger people. And provided we just abandon all these principles and start living life as before. So it's really all in our hands how the shape of the third wave, how high it will be, and how much more people will be affected. Depends on what we do, both from the government standpoint in vaccinations and making sure that everybody has access to it and quickly, and securing vaccines enough from wherever, and then from the public standpoint in maintaining the guidelines of social distancing and masks.
Right. And last question. So what would, in your mind, should medical practitioners bear in mind? I mean, they do know their job, but they are the ones who are in intimate contact with patients and perhaps feeling the brunt of patient and family pressure on prescriptions and medications and so on. So how should they be navigating the next wave?
Yes, and it's very, very hard. I mean, the heartbreaking stories from Indian physicians, the number of Indian physicians who have lost their lives is really, really, really worrying and heartbreaking. And I know that no one can function when you have 20 patients show up at the same time, or when you're the one person manning an ICU with so many people critically ill. So I don't think they could have done anything better, because in a resource-rich country like the US, in New York, we had 10-20% mortality in the first wave when the resources were all stretched thin. So really the question is, if we can build up, when the cases are down, resources, particularly hospital beds, ICUs, ventilators, oxygen units, so that if and when a third wave comes, that physicians won't be so stressed. And that's the first thing. And the second thing is, please avoid unnecessary medications and counsel your patients that all they need, like 90% of COVID patients will recover with just paracetamol, staying at home and waiting it out. Only when there is hypoxia, use steroids and seek medical care and oxygen. That's all that needed. There are very, very few specific treatments that work for COVID. A number of the ones that we are touting are only because, we want to do something. But they all are double-edged swords. They all come back. They're not proven. And I don't think we need to worry about, all these extra drugs.
Right. Dr. Vincent Rajkumar, thank you very much for speaking with me, and I do hope to connect with you again. Thank you so much.
Yes. Thank you so much for having me. It was a pleasure.